Welcome to my channel. My name is Priscilla, and on this channel we believe you are never too young to reach your full potential. Today I'd like to talk to you guys about non-hospital jobs. I know that the hospitals right now are getting over inundated with various different positions and various different things that are going on, drama, toxic environment, disorderly management. I just wanted to help you guys out there for people that just don't want to stay at the bedside in the hospital sector of nursing. Here's some quick hacks, areas that you can work in that's not within the hospital bedside specifically. Let's get started. So my number one avenue is to go work at a clinic. A clinic has various different sorts of areas. There can be internal medicine, pediatric, women's health, and family medicine, wound care, cardiac clinic. There is a very, very, very large amount of areas and clinics that you can work at that has less drama, less rigmarole from management and stuff like that. You can work at a private practice clinic as well. Those are actually very, very amenable to all different types of nursing positions. So let's think about that for non-hospital jobs. Number two would be home health. Home health is, you're still at the bedside. However, you kind of are doing your own thing. You go into the person's homes, you're taking care of them. And it could be pediatric home health. It could be adult home health. You're going to that patient's home and you're caring for them within that space. And oftentimes they get better, and sometimes some people grow out of home health, especially when it comes to the pediatric population. Number three would be hospice. Now, hospice is a position where you can go into the person's home and help them at their final hour, their dying days. But sometimes hospice is used for people that are going home, have a terminal disease, that need care constantly. Also, they need palliative care as well. So hospice can do that dual purpose. And whether the insurance covered or not, hospice will help that family through that final hour as well. So that is a very good place that you can be. And oftentimes it's not as depressing as people think it is. Next would be teaching. Do you have a BSN degree? Do you have a master's degree? Remote nursing positions are booming right now. Are you someone that can explain something? Are you passionate about topics within nursing? You should definitely think about teaching remotely or teaching within a classroom setting. So that is something that you guys should definitely think about, because every nurse is a teacher, because you have to teach the patient oftentimes you have to teach the patient what's going on, how to take care of themselves, and you have to teach the family member how to take care of themselves. So you are teaching, it's just in a different context. You're teaching other people your knowledge and your trade. So think about that. Number five is case management. Case management is something not quite not quite medical bedside nursing, but you are taking that patient's case to various different avenues, such as insurance companies. You're going through insurance company, helping them get covered for various different treatments and regulatory items. And last, infection control. I actually got a notification on LinkedIn that one of my old classmates is now an infection control nurse. And infection control can be in the hospital sector, in the clinic sector. They are working to prevent infection within the healthcare system. So this is a very, very awesome job position that you can think about that is very, very beneficial. If you guys have any questions or any concern, please leave me a comment down below and have an awesome day. Bye.